You're winning. You're winning. You're winning. Welcome to another episode of Epic Understanding. I am your host, Coach Love. I'm just going to start calling this the place where healing happens. We've been on this journey of studying different types of medicine, modern medicine, Ayurvedic medicine, spiritual medicine, and we're really taking a journey of healing. Tonight, my guest is Dr. Kul Anand, and he is just a really neat guy. He studied something called palliative care. This has made a very big difference, and not just study, but practice, I should say. Uh, this made a very big difference in the life of me and my mother. Um, it's something that's not commonly known, and it's really bridges the gap in between kind of like home health care and the hospital, things of that nature. Also, he is a internal medicine physician, and has a focus in geriatrics. Now, if that wasn't enough, he also practices acupuncture and Ayurvedic medicine, which is quite spectacular. I like his background because he is into studying the whole body and not just looking at us as if we are the sum of our parts. So, without further ado, welcome, Dr. Anand. How are you?
Oh, hello, Coach. Thank you for the introduction. Yeah.
My pleasure. My pleasure. You know, you have such a rich background. Did I miss anything?
Sorry, could you repeat, please?
I said you have such a rich background. Did I miss anything?
Oh, I think that's enough.
That's enough. That's enough. Um, well, if I'm not mistaken, I believe you will be speaking soon on a particular topic regarding how to stay healthy. I think was it how to not get old?
Yes, I'm giving a lecture in near future. Um, its topic is on aging, prevention of aging, Ayurvedic approach. So that's the lecture I have coming up soon. Yeah.
Absolutely. So that is wonderful. Tonight's title was how can the connection between Ayurvedic medicine, acupuncture, and modern medicine help you? And so basically, we're looking for how to heal the patient and how to stay healthy. Can you talk to us about that? What's the connection?
Yeah, yeah. I think basically all three systems that you named, the modern medicine, Ayurvedic medicine, and acupuncture, they're all there to help the patient in the healing system.
Mm-hmm.
Yeah, and each system has its strength, and each system has its flavor. The best news is that these systems complement each other, and we can use all these three systems of healing for the benefit of our patients.
What would you say is the major difference between, let's like, modern medicine and Ayurvedic medicine? What do you think the major difference is?
Modern medicine, which I practiced for decades, is mainly concerned with the body,
I
that we
see.
have a body, that we have a system, cardiovascular system, respiratory system, and it's just like a machine, like a car.
Mhm.
And if it breaks down, we can fix it. They did not consider at all, really, the role of the mind. And the mind came up only recently for us, last about 10, 15 years. And that's modern medicine. And spirituality is non-existent. Still, that they don't believe that there's such a thing as spirituality.
Oh, that's very interesting. That's very interesting. Um, we had one of my favorite doctors here, Dr. Patrick Cote here, actually about 2 weeks ago, and he dived very deep into the between spirituality and modern medicine. So I'm pretty sure he's going to stop by tonight to add his thoughts as well. So we'll connect some of those dots. Now you were um, director and deeply involved in palliative care. So many people don't know what that is. Would you mind sharing a little bit about that?
Yeah. Palliative and hospice care, they call it, is given to a patient when they think that the patient's survival is very short for whatever reason, for whatever diseases the patient has. And therefore, at that point, the patient is given this program. It's under Medicare, where their main priority is symptom control. Uh,
Mm-hmm.
and basically, they try to provide a holistic approach to the patient. And hospice is one exception where they look after the body, they look after the mind, and also, to some degree, they are involved in spiritual aspect as well.
Well, I also want to highlight with palliative care, I want to separate that out from hospice just because hospice is for someone maybe who doesn't want to be revived, who's terminally ill, versus the way my family, my mother and I used palliative care was to bridge the gap between being in the hospital and helping her heal so that she wouldn't, revert back to illness.
Yeah. The other palliative care is where the disease is advanced and the
Yes.
person or the patient doesn't qualify for hospice. And
Uh-huh.
they carry on with all other procedure, including
Mhm.
invasive procedure, such
Mhm.
as intravenous nutrition, radiation treatment. Um, Whereas in hospice, once you're in hospice, then curative modalities are off. They don't give you any curative modalities. It's just those modalities which are there for symptom controls are given. So that's the
Mhm.
difference.
Mhm. And so for for me, and I guess what I want, because it's just been so helpful. What I'd love for the audience to know is that although palliative care can be attached to hospice, which is kind of preparing for death, palliative care is a kind of a thing that can be attached in the middle to help you become more healthy. It was very, I'll just say this, without palliative care, my mother wouldn't have been restored because there was no, it was unhealthy, especially with COVID and her immobility and things of that nature. I really could not get her back and forth to the doctor very easily. So I needed for the physicians to come to the home. I
Oh,
needed, yeah, I needed for if there was going to be an X-ray or a lab uh, done. I needed for them to come to the home. And because of those kinds of amenities that was offered with palliative care, I was able to, get that, and it really bridged her to a point where she was able to get, greater strength. And
oh,
so
yeah,
that is,
right. That's a great help. That if physicians or if not a physician, a nurse practitioner can visit the patient at home, and some of the modalities can be given at home. You're quite right there, and that's a big help. Yeah.
it's extremely
Yeah.
helpful. Let's talk a little bit about acupuncture.
Yeah, acupuncture is a modality or a healing system in which needles are put in the body. That
Hmm.
Chinese believe that in the acupuncture system that there are channels. Sometimes they use the word meridians in the body, and these channels are not visible, but they are there in the diagram. They can mark, and then if persons remain healthy, if the energy, if the energy which flows through these channels flows without obstruction. When there is an obstruction to the flow, then the disease begins. And the function of a acupuncturist is to find out where that blockage is. And they examine the patient and make a diagnosis. And then they put the needles in certain locations so as to help the energy to flow back. And therefore the person is restored to health. If there's a pain, the pain goes away. Yeah, that is the acupuncture. In other words, it's the system where you put the needles in. It works on the body, but it also works to some extent on the mind as well, because that's also very much involved in the healing system.
I see. I see.
But in my case, when I practiced acupuncture, I was slightly different from other acupuncturists. After having my training in Ayurveda, spirituality was my routine in acupuncture. Now I'll show you how I use that. When a patient comes with pain, when the needles are put in, I tell the patients that I'll put the needles in, and once the needles are in, I want the patient to relax. This is the word I use, but in fact, what I want is the patient to be spiritual. And I ask the patient, do you believe in spirituality? Because in my Ayurvedic practice, and so in acupuncture, one of the questions I always ask is, are you spiritual, or do you consider yourself to be spiritual? So I can give you an example I gave you the other day, that this patient came up for back pain, and I put the needles in, and I said to the patient that once the needles are in, I want you to relax. No, I want to find out patient's spirituality. I said, what happened if you have a serious problem in life? What do you do? He said, Doc, I'm a Catholic, I pray. I said, okay, I want you, when you are under acupuncture, think about Christ. Not Christ on the cross, because that's violence. Christ looking at your face and smiling. And Christ is just love and peace. I said, you look at this picture will go away, but automatically it will come back. And I want you to enjoy that, your picture. So I gave him acupuncture. And once I took the needles out, he said, Doc, tell me the truth. Did you put any tranquilizers in your needles? He said, this was one of the best acupuncture that I had. I was so relaxed. So I always use spirituality along with acupuncture.
Now, I must ask a mischievous question. You want the patients to relax, but you're putting needles in them. Do they hurt?
Needles?
Yes, do they hurt? Needles give me anxiety.
Coach, that's paradoxical. I mean, very strange that the patient has pain and patient comes to us to get the pain relief, and we put the needles in.
I see. But is there any sensation with the needles or no?
In fact, needles are, in general, they don't cause much pain. Yeah. If there is a considerable significant pain, it means the technique is wrong, or the acupuncturist has picked up the wrong side. In general, there's very little pain. Yeah, and it's very relaxing. One of the things is that difference you have is that with modern medicine and acupuncture and Ayurvedic medicine, that this has extra benefits. In modern medicine, you have side effects. Ayurveda and acupuncture, you have side benefits. For example, even though the patient is coming to me for back pain,
Mm-hmm.
and patient begins to feel better, sleeps better, and he begins to get more energy.
I see.
So these are side benefits.
I love that. Instead of side effects, we get side benefits. That is very impressive. I like that. I like that a lot, I must say.
The reason is why there are side benefits. The reason is that the approach is different. In modern medicine, we diagnose and we are treating the condition. In Ayurveda, and so is in acupuncture, it's the balance. We talk about balance. When the balance is maintained, one enjoys good health. And the
Ah,
disease come up when that balance is disturbed. So once you correct the balance, even though the patient has come to you for abdominal pain, once you correct the balance, the patient begins to get more energy. His relationship with in the job improves, and he begins to enjoy life.
oh, that makes a lot of sense. That makes a lot of sense. Hmm. Maybe I'll try it. Maybe I'll fly to New Jersey.
I mean,
I'll
well,
have to come in from New Jersey and let you help me.
I
But
wish.
there's a question here. So people were able to send in their questions in advance. And there is a question here about um, hot flashes. Okay. So Michelle wants to know what type of medicine will help her with her hot flashes. And then what practice should she have?
Well, hot flashes are mostly seen around age 55 to 60, 65. That's the period. Uh,
Hmm.
they call it post-menopausal syndrome. Um, and there are a couple of reasons for that. For example, from Ayurvedic perspective, that it's usually an air disorder or vata disorder, but sometimes fire component is also disturbed. Um, so the general approach is when a person has these hot flashes is that in modern medicine we know that we have got two systems. One is parasympathetic, the other is sympathetic.
Hmm.
And for some reason, the sympathetic system goes overdrive, is working too much in these women who are getting postmenopausal syndrome. And
Hmm.
important thing is to bring the opposite system, that to opposite to sympathetic is parasympathetic.
Okay.
Parasympathetic is the one which relaxes you. It gives you
Oh,
peace and quietness.
okay.
And so what you do is Ayurvedically, you do certain modalities which tries to increase the parasympathetic system. One is that you begin with, there are many things one has to do. It's a multi-pronged approach in Ayurvedic medicine. One is that you look at the nutrition, for example.
Okay.
Yeah, the person should eat the kind of food which is good for ear disorders.
Hmm.
Food should be freshly cooked and warm, preferably the warm food should be given. And then it should have fruit and vegetables. That should be the main thing that one should consume. Which also, from modern medicine point of view, it makes sense. If you look at some of the research, it shows that free radicals, when oxidation goes in our body, we need oxygen. When we are consuming oxygen, it's undergoing what we call as oxidation process. And in that, free radicals are produced, which are disease producing. And free radicals are produced more when you take food which is highly processed.
Mm.
So free radicals go down, it means you are healthy if you eat fresh vegetable, fresh fruit. Um, so one should do that. And in addition to that, massage is very helpful too, because massage is It tries to calm down the vata or air, and medically it tries to produce a parasympathetic state. So massage of the feet is helpful, massage of the abdomen, and then pranayama is helpful. That breathing exercises, particularly alternate nostril breathing, and modern medicine tells us that pranayama or breathing exercises you stimulate the parasympathetic system. It means you
So
breathe.
how does that work? I mean, do I just do like this?
Yeah, you basically very simple. You breathe in, close the right nostril.
Uh-huh.
You breathe in gently, slowly, and then once you're breathing totally, you breathe it out from the other nostril. So I'll show it to you.
Oh, I never heard of that before. That's really easy. I'm gonna practice that. I actually felt a little bit of release in my back when I did it.
Yeah,
Just now, I like it.
yeah,
I
and
like it.
it is a very soothing effect, and it's also to some degree spiritual. Why spiritual? Because when you are at present moment, when
Mhm,
you are in the now, no means when you're breathing. What
mhm.
is now? No is just Almighty God, or it's the nature, or it's the consciousness. So it's partially spiritual when you're doing alternate nostril breathing, and it stimulates the parasympathetic system, so you calm down. And yoga,
That is just fantastic. That was so simple, and my like here in my back feels like instantly like some relief in those muscles. Wow.
hot flushes. Apart from that, one can do, for example, yoga, particularly God's position. When you
Mm.
do God's position, you are removing or suppressing sympathetic system, and parasympathetic takes over. It produces peace and harmony. Moreover, science has shown that yoga decreases free radicals. So here
Mm.
yoga is also preventing that. Um,
We
then,
had a audience member join us, and I saw him practicing that backstage. Did you do? I mean, did it work for you?
I mean, I do feel a little more relaxed. So
Where did you
um,
feel it? Where did
I
you
f-
feel it?
I felt it the same way you did, in like on like my back, like at the top, like
That's
something
incredible.
something just like there was just a feeling of like relief going down.
Yes,
mhm.
yes. Audience, please do that. Please do that and tell me about it. It's amazing. It's amazing. We had listen, you may have given us a quick cure just like that, that one little thing. There's a question that came in about can anxiety be controlled through acupuncture?
Mhm.
Yes? Yes.
Is
How does
acupuncture
that work?
very effective in controlling anxiety. Yeah.
Okay.
And the point is that being in modern medicine, when we treat anxiety, we produce a lot of side effects. By the way, when I would like to make it clear that all knowledge is to be respected, whether it's
Mm,
modern medicine, Ayurvedic medicine, or acupuncture. We must respect all knowledge because this is what Ayurveda teaches you. But after having said that, you see, with the pros and cons, with each patient is a different thing. So each system has strength and its limitation. One other thing is that when we treat anxiety with modern medicine, it produces a lot of side effects.
mm.
And that
Yes,
is
yes.
a high price to pay. And
Mm,
the point is, when we got so simple method, not only so simple, so effective methods that you can control anxiety. It's
mhm,
Ayurveda and acupuncture both are excellent in controlling anxiety.
mm. Very nice. Um, Patrick, hello, hello, hello.
Yeah.
Hi there.
Voila, you're on the screen. Um, I know you heard some things that Dr. Anand said about spirituality and how he's been making these different connections between all the types of medicines, what are you receiving from his thoughts?
Well, I'm enjoying his lecture very much, and I agree with what he's been saying. And we have to look at the whole aspect of the person. We call it the holistic aspect, mind, body, and spirit, which is what Dr. Anand is recommending. And I certainly agree. What he was saying, there are so many techniques in Ayurveda and acupuncture to help decrease anxiety. One of the things I love the most is Shirodhara. I'm sure doctors well aware of Shirodhara, where you
Well, I'm not. What is it?
oh, okay. You have the patient lie person lie on the table, relax, and we drip warm oil on the forehead. And you say, well, what is that supposed to do? Well, it's extremely relaxing. I had a friend of mine who was extremely nervous, shaking all the time. And he's very nervous. Everything is cancer. It's a cancer. It's a cancer. Everything he had, he thought it was cancer. So I said, you got to relax. And he's one of those persons that couldn't slow down. He was always jumping and couldn't sleep at night. I said, you better come in for Shirodhara. So I did a treatment on him, maybe for about 20 to 30 minutes. And he fell asleep. He
Oh,
slept
wow.
for hours. And when he woke up, he was a different person. He was so much more relaxed. And that's one of the many things we have to treat anxiety. There are so many different things. There are other kinds of techniques called emotional freedom techniques that can treat many kind of anxieties and problems besides Ayurveda. But the one nice thing about Ayurveda and acupuncture, there are no serious side effects. I mean, we treat patients for depression and they develop tardive dyskinesia. Then we have to give them more medication to treat the tardive dyskinesia. And then they get more side effects from that. And yet it's a domino effect. Well, fortunately, with Ayurveda, we don't have those problems. Ayurveda, Chinese medicine, there are a lot of herbology is a wonderful course to take and can be very, very helpful for people.
That's beautiful.
Matt, what you said is
Dr. Anand, you have a question in regards to addiction. What do you recommend to break addiction other than going to a standard clinic?
well, I think for addiction, Ayurveda is very effective. And acupuncture, the modern medicine tells us acupuncture is also effective. I think it doesn't matter what do, but Ayurveda and acupuncture should be part and parcel of the management of addiction. In addition to that, person can use anti-nicotine tablets or whatever one wants. But from healing point of view, if patient also gets Ayurveda and acupuncture, that the result will be very good indeed.
Okay. Very good. So I don't want to jump the gun, but I'm kind of hearing that Ayurvedic medicine might be a better way to break an addiction than modern medicine. Are you saying that? Is that what you believe?
I think each discipline is right in its own place. What I'm saying is that all three modalities should be used. It's very
Okay.
important. If we just leave it for modern medicine, the results are not good. So Ayurveda and acupuncture should be part and parcel of the whole process.
So what is the chief where does modern medicine shine? Where does it really, do its best work?
Oh, modern medicine is you mean the area in which it shines?
Yes, where does it really do its best work?
Infections. Initially, control of the infection, what kind of infection it is, it's very effective. But
I see.
endocrine system, it's very effective. But the problem arises that if I see a patient with pneumonia. I saw him today. I treated him with modern medicine, and 6 months later, he's back again to me. And 3 months later, he's back again to me. Why it's happening? There, modern medicine cannot help you. They will, every time they will diagnose, they'll find out bacteria, they'll find out sensitivity. But why is getting repeatedly, they cannot answer that question.
But Ayurvedic medicine can, is that right?
Ayurvedic medicine is, the whole approach is to strengthen your immune system. It's all aspects of your life. It involves all the modality, your lifestyle, your nutrition, not only yet your thinking. Ayurveda is the only specialty which clearly states that the mind can produce disease and mind can cure disease.
Oh, now that's quite fascinating. That is quite fascinating. Now, we hadn't talked about that before. Patrick, what are your thoughts on that?
Well, yeah, you asked where does modern medicine shine, and I think in crisis situations, we need to intervene with medication if there's a crisis situation, and it's certainly if there's a surgical indication, we have to intervene with surgery. But after that, after the crisis situation, then these things become very amenable to treatment with Ayurveda, acupuncture, combination of both. And I think that's where we should go with that.
You know what? I think I have to say, this is, I don't know, I'm going to say maybe the second most helpful thing that I learned tonight. It's pretty awesome. The alternate nose breathing, I probably will use that for the rest of my life. And I'm going to teach it to my mother and my students and my clients, just because sometimes you're very tense. And when I said I felt something immediately, it was like, wow, right?
You try to do that for at least a minute.
Yeah.
Yeah. Helps
But
control the entire body.
Yeah, at least 10 minutes a day.
Really? I should do that every day?
Yes.
Wow. Wow. And then I learned from today that it is good to use modern medicine to treat like the acute situation, but then move more towards, a holistic approach to minimize and restore full health.
Well, Ayurveda, if you practice Ayurveda on a daily basis and follow its principles, hopefully it will prevent any of those crises situations from occurring.
Yeah.
As Dr. Anand has been.
Yeah. I think the other part is, I agree with him. Also, I go a little bit further, that once the crisis situation has come up, for example, a patient has acute pneumonia, the doctor is treating, let them continue what they're doing. The Ayurvedic should come in, given the proper kind of diet, if he can eat, massage, do it, and talk to him in a manner which sends a positive signal. Here, sometimes, you see, not that doctors are bad, they will tell you that you've got pneumonia, your chances of survival are only 10% with this extensive. I mean, that kind of news, you have to be very careful. We should give the news in a manner which is in a positive manner, and there are ways to do it. And that's very important. I think the doctors are not trained in it. One of the things which I used to take my student with me, when I went around the patient, did the round, never on any one occasion I used negative language, always positive, upbeat. And I will listen to the patient. And for example, if walk into the room, the patient is reading something. What are you doing? For example, he says, I'm reading Bible. Why are you reading it? Oh, it helps me, doc. I said, you continue to do that. It's important. I'll say, just 1 minute. It doesn't take much time. I said, prayers also help. I'll do my job, you do yours. That's it. The patient begins to improve. And one of the striking example, it was a lesson for the students that I came across. A patient, 65 years old, underwent coronary artery bypass graft. And she came under my care for rehab. And every day of surgery was done perfectly well. Every day I did the round, a new symptom. I'm feeling dizzy. I got tummy pain. I've got a heartburn. So a couple of times I just added new medication. Then I figured out, I think there's something wrong. That's what with me. So I stopped and I had some time. So I said to her, Mrs. Smith, it wasn't her name, by the way, Mrs. Smith. I said, Mrs. Smith, your surgery went very well. You're on the right kind of medications. And you have a lot of symptoms. Yes, doc, I have a problem. What do you mean? I have a problem. I said, listen, is there anything else that I can help you with? She said, no. I said, do you get family who visits you here? Because I didn't know. She said, I have no relatives. The nurse whispered in my ear from the chart. She has a daughter. She said, I said to her, I said, Miss Smith, you have a daughter. No, doc. Tears started flowing. I don't have any daughter. I'm alone. She left 25 years ago and then she never called me back. I'm alone. So at that point, I put my hand on her hand. I said, listen, Mrs. Smith, I left India decades ago. And before leaving, my father called me. He said, listen, son, this is, I'm talking about now in 60s. Whereas there was no cell phone. Telephone was difficult. Letter will take you 14 days to reach there. He said, son, I want you to listen. When you have been here, you have not been alone. Mm-hmm. When you go to a foreign country, whatever this always said, you will never be alone. And Mrs. Smith never allowed me. She didn't allow me to complete the sentence. She said, Doc, thank you so much for reminding me what I had forgotten. Mm-hmm. And here was an example in front of me. Next 5 days, all symptoms vanish.
That's amazing.
Symptoms disappear. Here is a student could see the example that multiple symptomatology just went away by a tiny spiritual approach. It didn't take much time on my part to just 5 minutes or so.
That's beautiful. So I love that story. And you know what? I mean, this is a question. It's from a Facebook user. They did not reveal their name, but this is the question. It says, does acupuncture help with erectile dysfunction?
Yeah, it's worth trying, and along with Ayurvedic medicine. Mm-hmm. You see, one shouldn't rely on, you see, you can go for modern medicine, but there are side effects. See, with Ayurveda, when you go for this, your whole body improves. Mm-hmm. Your eating improves, your energy improves, your food improves. You start meditating, you start doing other things, massage and all that, your whole body function improves. So I would suggest that one should go for modern, for Ayurveda and also acupuncture. One should is worth trying.
Where is the, where did Ayurvedic medicine begin? Where did it start?
Oh, it's about, I think, at least 5,000 years ago.
5,000 years ago. Wow, that's very impressive. But what continent did it start on? And or who is the creator? Who's the father? Who's the mother of it? Where did it come from?
Well, they say it was God Dhanvantari, the God himself, started it. This is how it's said. And then it passed on to the human beings. And this is how it started.
I see. And I'm curious, Patrick, what are your thoughts? What have you heard about this?
Well, Ayurveda started in India at least 5,000 years ago, maybe even before that, because before that, that's when it was the Vedas were written around 5,000 years ago, but apparently a lot of this information was passed down by word of mouth until it was finally recorded. It started in India, and I was when I was studying Ayurveda on the Swami Tirtha, I was very impressed with the knowledge and how there's so much of an overlap with modern medicine, and now Ayurveda explains modern medicine in so many different ways. I asked him, where did this information come from? Because it was amazing. And he said, well, it came from the angels. And I said, well, maybe, yeah, it came from the angels. But maybe he had something there, because when you look at the origin of the word angel, it's angelos in Greek, and that means messenger.
Oh, I see.
So this information was carried to the people of India thousands of years ago by messengers, if you will, from God.
Yes.
And that's all I'm going to say.
Hmm. Well, in the Bible, um, Luke was a doctor. Yes.
Yes. Yes.
So I do wonder what kind of medicine did he practice?
Well, I'm sure it was some sort of a complementary type of medicine.
What do you mean by that?
It wasn't, well, based on, what is it, bio, phlegm, fire, the three forces of nature that it probably came from India,
Hmm. Hmm.
and it spread to both Greece and Egypt, Asia Minor. Now, in what form it took, I'm really not sure. I can't say.
Hmm. Dr. Anand, do you have any history of what kind of medicine Luke practiced?
Sorry, could you say it again?
Do you have any thoughts or any history about what kind of medicine Luke practiced?
I have no idea. I think bad what side. I think that probably is the explanation. Yeah.
I'm curious. You know what, that thought just popped in my mind, and now I'm rather curious about it. I think that I should look into that, guys. If there's an expert on this matter, please help us out on this. I would absolutely love to know that. David, did you have a question that you wanted to ask?
I do. Dr. Anand, I actually wanted to ask, is there anything close to uh, that's close to acupuncture that's practiced to unblock energy or chakras?
Well, there is, if one doesn't want to use needle, there is called acupressure. Acupressure is the same thing. For example, if you are traveling by ship and you feel sickness, you put your two fingers here and you press
Mm-hmm.
10 times.
The pressure points, right?
Pressure points. So there are pressure points. There are a lot of pressure points in Ayurveda and also in acupuncture. Only thing is that the pressure points are, say, effectiveness is much less. If needle is 100% effect, then acupressure produces maybe 5%, 10%. But the point is with acupressure, you can do it several times during the day. So they are effective too, yes. In fact, a lot of, if you go to Chinese or massage, for example, any massage, not necessarily Chinese,
Mm-hmm.
some of them have been trained to press those acupressure points. They are doing, for example, they go to the neck and they are pressing at the back because these are two pressure points. They press the pressure points in the back as well. Yes, you
Mm.
don't need the needle, you don't want it, you don't need it. You can certainly get over that by using the pressure points. Yeah.
Oh, that's interesting.
You know,
Thank.
Patrick is a radiologist, and of course, you see pictures all day long of, broken bones and, you know, uh, infection, that's reached the bone and things of that nature. Is there any way to heal that kind of thing with Ayurvedic medicine?
You mean
It depends on what we're dealing with.
huh?
Okay, so maybe like even arthritis.
Uh-huh.
Sure.
Or
What would you? I want to hear from both of you. Who wants to go first on that?
I'll
'Cause I'm
let
very
Dr. Anna go first.
arthritis Ayurvedic approach is very good actually.
really.
Yes, it's there are quite a few remedies for arthritis. Um, and again, once again, nutrition is involved because many arthritis, that they say it's the inflammation. Inflammation
Mhm,
is
mhm.
very widespread and causes a lot of diseases. And in Ayurveda, we have got quite a few, even kitchen spices have anti-inflammatory
Right.
properties such as ginger and turmeric. Uh, and then, in addition to that, there are certain oil massages which are helpful. Ayurveda uses that. And then heat treatment, you can use that. And sometimes, if you go to Ayurvedic practitioner, depending upon the etiology, what it finds wrong with you, then they recommend or do other methods, which might include animals sometimes. Um, so approaches, there are a lot of things that they can do.
Okay. Okay. I have a Facebook question here. It's what would you recommend for chronic cellulitis?
That's first thing is that one has to find, if one goes to Ayurvedic practitioner, he will do a general analysis and examine the patient, take detailed history.
Mm-hmm.
Now, cellulitis mostly it's a pitta disorder. I can give you an example. I got a patient with a rash and horrible looking reddish rash, and it went into cellulitis. And when I examined this patient had on history a pitta vata disorder, which is heat and vayu. And what caused the rash is that this patient, somebody told her to take carrot juice. So
Mm-hmm.
this became only clear later on once she came to me. Actually, she came to me for acupuncture. Of course, I gave her acupuncture, but then side by side, Ayurvedic diet, I told her that's a heat produced. I told her what kind of diet to take so that it's a heat pacifying diet. I told her cooling technique, what should do general, for example, alternate nostril breathing.
Mm-hmm.
Stress has a lot to do with it. Heat. Stress creates pitta disorder. So I gave her other techniques to relax. But what became clear on the second visit was that this patient was taking tons of carrot juice. She had a big bottle and she was taking this. So here is an example where she being a heat and air disorder, she was unbalanced, comes back to again, unbalanced, because she was taking too much carrot juice. Carrot juice is eating but slightly, but she was taking so much that was responsible. So I basically asked her to stop carrot juice and take it only small quantity. She already had received antibiotic from the doctor, so I couldn't stop it. I said, you carry on with that. Everything was resolved. That's it.
So someone with chronic cellulitis is out of balance, is what you're saying?
Yeah, chronic cellulitis, and for that matter, any chronic eczema or chronic irritation or chronic dry skin, in my opinion, Ayurveda is much superior and without any side effect. You see, the steroids are used so extensively. If you go to a dermatologist with dry, scaly skin, I can assure you they're going to put you on steroid. They're used so frequently. So Ayurveda is very good with that. You get the condition resolved nicely, and there are no downside to it, and there are other general side benefits. This is one condition. There are certain conditions Ayurveda does an excellent job, and this is one of them: chronic sinusitis, chronic cellulitis, or eczema, or chronic dry skin, which is very common in the elderly.
Hmm. Very good. Very good. Okay, I want to jump back to Patrick and give you an opportunity to answer the question in regards to arthritis.
Oh, yes. I noticed that the Swamiji came on and wrote a little note there on the
Yes,
bottom
he
of the
did.
screen. And since he trained me, I'm going to have to go along with what he said. And I have arthritis in my hip,
Mm-hmm.
and I should have had a hip replacement a long time ago. But I've been taking turmeric.
Mm-hmm.
I don't know if you ever heard of golden milk, but anyway, you add water and you boil it, blah blah blah. Anyway, I've been taking that along with fish oils, and it's been helping a great deal. So I don't have to take as much medication, as much Aleve or Advil
Mm-hmm.
as
Mm-hmm.
I normally would. But there are a lot of other agents that can be used depending on what kind of arthritis. There's Yogaraj, Google.
Yes.
I'm sure Dr. Anand knows all this. Um, and also Mahanarayan oil. Doctor was mentioning oils. There's a special oil that is very, very helpful,
Mm-hmm.
especially when it's heated, or you can put the oil on and then heat wherever you have the pain. Usually, arthritis is due to an inflammation or dryness, too much vayu, vata, if you will, dryness in the body. So you have to try to get some more oils in the body. But that's one, the rheumatoid arthritis, that's an inflammatory disease, inflammation, and that's treated entirely differently. So it depends on the kind of arthritis we're dealing with. But the run-of-the-mill ordinary arthritis, these are some of the things that we use to treat, and they're usually pretty helpful. Yes, turmeric is awesome. Arthritis is DJD. Absolutely. Absolutely. You're right.
What is a DJD? I don't know what that means.
That's degenerative joint disease.
Ah, I
It's
see.
common. It's common,
I see. I see. I see.
especially in the knees. That's what,
Mm-hmm.
or even in the fingers. You get that.
Mm, I see. Okay, we have another question here regarding um, diabetes. So, do you believe that acupuncture will support healing for diabetes for the pancreas?
Yeah, it is effective, but apart from acupuncture, you got to use other modalities too. And Ayurveda comes in. Um, Acupuncture is effective because it has some effect on the weight of the person, and most of these diabetic patients are overweight.
Mm-hmm.
And decreasing weight is very important. Um, so weight is one thing. Second is they can put in some needle and modify the appetite of the person. So that one,
So, um, acupuncture will help with weight loss?
yes, yes,
Huh,
Mm.
yeah,
I've never heard that before.
yes.
David, you've heard that before?
I actually haven't, but
Like,
that's
I
very
feel very
interesting.
shocked.
Yeah.
I
So,
feel shocked.
so one can use acupuncture, and Ayurveda is also very good because it goes one step further.
Okay.
That based on the taste, it advises the person what to eat, how much to eat. Yeah. And modern medicine is good in counting calories. You see?
Healthy
And
carrot.
when nothing works, at least they can tell the person that you need to have this much calories, and that's it. If you don't stick to that, your diabetes will not be cured.
Okay, here's another Facebook question, and it is about the your body type. So hold on one second. Is it true that you're supposed to eat based off of your body type?
Sorry, could you say it again?
Is it true that you're supposed to eat based off of your body type?
That's right. That's very important because diabetes is basically comes up due to imbalance. Yeah. Uh, for example, people who are kapha constitution, they got to be on water constitution. They have to be extra careful. It means they should be taking diet and having lifestyle, which is basically doesn't provoke kapha, so that their weight doesn't go up, weight if at all comes down, and they have to control their appetite, and they have to relax, do yoga, meditation, and all those things in order to control weight and prevent diabetes.
So I've heard of this body type, but I guess can you share the different kinds of body types there are? Um,
Yeah, there are basically excuse me, three body types according to Ayurveda.
mhm.
Predominantly Vayu or air constitution, and then is predominantly fire constitution or predominantly kapha constitution. No, there can be combination of these. For example, it can be Vayu and Pitta, or Pitta and Vayu, or uh, uh, Kapha and Pitta, or Pitta and Kapha. So there are combinations too. But the main difference is that air constitution are usually slim people. They talk
Okay.
fast, they walk fast, and they're somewhat irregular in their regime or in their schedule, particularly when it's unbalanced.
Hmm.
And these are the people who are very good in parties. They will meet one person and another person, another person. They meet one person, speak to him, go to the next one, and by that time they've forgotten what was the name of the first person. Their memory is not.
Wait, hold on. What does this have to do with types? And I'm sure it does, but I want to make sure that the
Their
audience
memory is
gets
not that
their.
good. That particularly if they're unbalanced, it means they may go out of focus. But
Okay.
on their positive side, they are very innovative. They're intellectual. They can invent new things. Um, but this is how they are. And the Pitta type are basically medium-sized build, and these are
So
people
I
you.
want to get a diagram up here so that we can actually take a look at these body types so we can kind of grow together with this. I actually think this is pretty interesting, to tell you the truth. Um, all right. There's a Vata, Pitta, and Kapha. Is that right?
That's correct. Yes.
Okay. Can everybody see that? No, there's a big X over it. Okay. All right. All right. So share with us the Vata type of body type and what happens here with this.
Yeah. But the Vata type are, as I said, these are people who are slim. They are not very regular in their habits. Sometimes they have teeth. They have got irregular teeth. Their skin sometimes tries to be rough. But when they are balanced, they are very good. They are innovative, and they are very good with meeting people. They are the life of the party. With a constitution or medium build, they are um, they are mostly leaders, politicians. They are very good in planning and executing the plans. But they can, if they're unbalanced, they can get very edgy, very irritable, and sometimes angry and pretty sharp. And they tend to get disorders which are due to heat, such as indigestion, too much acid in the stomach, urine infections, sinusitis, those kind of things. Kapha type these are the type of people who are somewhat on a heavier side, and they are relatively easygoing. These are the people who can watch TV sitting on the sofa for hours together. But their memory is pretty good, and they are pretty good otherwise in their routine. They tend to get diseases which are kapha diseases, such as diabetes, but sometimes they get kapha type of depression and other kapha type of disorders. So these are three personalities. But basically,
and what about the pitta? What is this?
Sorry?
What about the pitta?
Pitta. Pitta is their diseases, as I've indicated, are all due to heat. And diseases can be body diseases, such as acid in the stomach. Mostly infections are pitta infections, sinusitis. And they can also get a lot of mental agitation, anger, sometimes. When there's a party, pitta is the first person to go for eating because they feel very hungry. They can eat a lot. So they run for the food, you see.
Oh, so they're often very hungry.
But there's no choice in between these. Doesn't matter what dosha one is. If one is balanced, one is in good shape, one is healthy. But problem arises when somebody is unbalanced. So there is nothing to choose between these three.
So we're all these three at one point.
If they are balanced, they're excellent.
Okay.
Well, no, but I wanna tease that out. You are either one or the other. You're not all of these. Is that right?
Sometimes you can be all of those.
So wait.
Yeah.
I'm not connecting those dots.
Yeah. You can be either two. Occasionally, you can have all three together in one. That they're equally present.
Really? Wow. Patrick, what are your thoughts on this? Help me understand.
This is what dosha. Three. They're together.
I know what Doc's talking about.
I don't know. I'm just going maybe Father, Son, Holy Spirit here.
I don't know. See, Vata, Pitta, Kapha are also relate to ectomorph, mesomorph, and endomorph.
Yeah.
I don't know if you've ever heard those terms. And
what
really,
do they mean?
Yeah, you see,
it depends on which or how many of the germ cell layers in the developing embryo, which one predominates. So if the ectoderm predominates, person will tend to be ectomorphic, very tall, thin, difficult gaining weight, very, very active. If the mesoderm predominates, then there's somewhere in the middle between Vata and Pitta, between ectomorph and endomorph. The endomorph comes from the endoderm of the germ cell layers, and that also produces the GI tract and the nervous system, neuroectoderm, neuroendoderm. I'm sorry, the GI tract. The ectoderm also produces the neurologic system. That's why they tend to be more sympathetic. They're sympathetic dominant, more active. I could probably give you an example of this. I remember a long time ago, I heard Dr. Deepak Chopra talking, and he talked about, I don't know if I mentioned this to you one of the meetings. Anyway, he said he was on his way back to Los Angeles, and he was stuck in Chicago at O'Hare Airport, and it was snowing, and they canceled the flight back to Los Angeles. Well, he said all the Vata people started crying and running around, making phone calls, very hyperactive, trying to find out how they're going to get back to Los Angeles. The Pitta people were pounding their fists on the table, demanding that they find that they let a plane go back to Los Angeles. And they were screaming and yelling at this poor woman behind the counter who had nothing to do with it. And the Vata people just gently sauntered off into the ice cream parlor. So if you think about Vata Pitta Kapha, that sort of summarized the kind of people they are, especially
Wait, and what were the Kapha people doing? What were the Kapha people doing?
They just quietly sauntered off to the ice cream parlor.
Okay. So the Kapha people went and got ice cream. The Pitta people were banging, and the Vata people
They were angry.
What were people doing?
They were frantic. They were very
They were
anxious,
nervous,
and worried,
right?
and crying and running around like crazy, trying to find a way back.
The example I can quote is,
let's take a look at this chart again. So the Vata people were nervous, Rex.
Yeah, they're sympathetic dominant. Vata people, they're very nervous, hyperactive, always on the move.
Yes.
And one of the tenets of Ayurveda is like increases like. So if you're a Vata person and you do a lot of running around, so you have a job where you're driving all over, rushing around, got a time limit on what you have to do, that's going to affect the Vata people.
Yeah.
And then the Pitta people, the Vata people tend to be tall, thin. They have usually have difficulty gaining weight, like the basketball players. They're nice and tall. Although even very short people can be Vata people, very short people. The Kapha people tend to be heavy. Kapha is heavy. It's made up of water and earth, so they're grounded, they're heavier. And the Pitta people tend to be a little more muscular, and somewhere in the middle. The Kapha people can be very varying in size, but do not tend to be very, very tall. But as I think Doctor was saying before, that you could have a combination, because we're all born with Vata Pitta Kapha in our constitution, but one or possibly two may be higher than the other. So you may have more Vata and Pitta in your constitution and lower Kapha. Or very rarely they have all three at the same level. Usually one or two will predominate.
You know, I bet you neither one of you can guess what I'm thinking. I'm thinking which one of you gentlemen are going to talk about this at the Mind, Body, and Spirit Healing Summit? That's what I'm thinking.
That's your call.
We'll figure it out. But I definitely think that this should be talked about. Yeah. And if Swami were here, I would want to know how that affected our angelic connection.
Let's see if Swami's going to react to that. I don't know.
Because he's a thin guy. So does that mean he's a Vata? But he doesn't strike me as a nervous type. He's very calm.
No. You see, the other thing is there's some controversy over this. Is you could be one body type, but you may have a different mental type.
Yeah, you know what? He mentioned this. He mentioned that you have an Ayurvedic body type and mental type.
Yes, it could be different.
When I make an assessment in Ayurvedic practice, the body type and the mental type are both done separately. Yeah.
Oh,
very good, Doctor. I'm so happy to hear that.
Yeah.
Is there a test that you can take for this?
Yes.
Oh, listen to this. This is very funny. He says I'm all three.
Honestly, I'm kind of thinking I'm kind of thinking the same thing, honestly.
You think you're all three?
I'm
So
leaning more towards Vata and Kapha, but
Mhm.
at the same time, I'm I'm reading Pitta, and I see there's some things that definitely describe me. So
And you want to know something? I would like to see how your astrology chart fits into all of this. And,
mhm.
because there's so many things that we can use to help us understand who we are and our mission, right?
Mhm.
We can use those things. I just wonder how they all fit together because I am I believe in God, I believe in Jesus Christ, and I'm very much a Father, Son, the Holy Spirit kind of person. So, my heart is more like a radiologist of religion, okay? Very, very neat, boom, 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 boom. At
Mhm.
the same time, I believe fully in spiritual things, and I know not that they're so different, but when you talk to people who have a heart for religion, sometimes they lose you know a connection with spirituality because they're so rule focused, if that makes sense.
Yeah. Well, that may not be a bad thing for that person. If
Hmm.
that person believes in all the tenets of the religion, which is wonderful, and
Hmm.
that they're a good person, that's all they really need.
Yeah, and it's not a bad or a good thing that I'm speaking of. I'm
Mm.
saying how all of these ideas and thoughts can be housed into one heart and to in one mindset, because if you think about some things that you hear, you read, and maybe you don't embrace, you know you don't understand them holistically, it can lead you to think that one is opposing the other. I'll give you a great example how some people believe that modern medicine opposes Ayurvedic medicine. Yeah, it's not true.
We're not jumping in with an answer.
Well, that's okay.
Yeah.
That's okay.
No,
Uh,
it's
David, did you have
unfortunate.
one quick question before you go?
uh, I I mean that one question was the question that I had. Like, I really just wanted to know if there was anything similar to acupuncture uh, that was beneficial, that kind of worked the same way, and I got my answer,
All right.
and I'm
Well,
very
we'll
happy about that.
thank you for stopping by, David. You're always a great audience member. We
Yeah.
appreciate you.
Thank you.
And
Thanks, David.
hopefully we'll see you next
Thank
week.
you, sir.
All right.
Good seeing you.
Yes. Okay. So we are slowly wrapping up here. Is there anything burning that you'd like to cover, Dr. Anna?
I think we covered very well, and I didn't mention another point, which I think Swamiji taught me very well. One of the Ayurvedic principle is that anything which is subtle controls the gross. For example, in a truck, it's the battery which keeps huge truck going. So our body is gross and the mind is subtle, and therefore mind controls the body. And when it comes to spirituality, that consciousness, that even is not even a matter. And I think spirituality has a most powerful healing effect. And I think the more research should go into that direction, which is, in my mind, it's not going to happen near future because there is no money in it. If you show that spirituality is a powerful healer, nobody is going to make money out of it. And there,
Yeah,
we
I
are,
think people have trouble billing for it.
yeah.
Oh my goodness. Oh my goodness. Patrick, what are your thoughts?
When you deal with the patients, and to be honest with you, I can explain to you, I think what I call is spiritual disconnection.
Ah,
And when I do my round, one of the things I am always looking for is this person spiritually connected or is disconnected? And I have the patient with that way. I don't use that language, but in my own small way, the way I will say the thing, the way I interact the patient is to encourage spirituality.
I see. I see.
Right.
You encourage spirituality. You know what? How would you address these things? I'm curious with someone who was an atheist.
Could you repeat it again? Sorry, I use hearing aid, and sometimes it doesn't come up clearly.
Okay, how would you address these things with someone who is an atheist?
Oh, it's very simple. I had a patient who came for acupuncture, and in the form, one of the questions, are you spiritual? He said no. So when I was going to put the needles in, I said, what do you do if you have a life-threatening problem or you have a very severe problem in your life or tragedy? He said, Doc, I go on Jones Beach early morning. I said, why do you go to Jones Beach when you have a problem? He said, I can't explain, but I get something nice feeling in myself. So at that point, I said to him, I said, when you go there and you have a peace and harmony, this is because it's nature. And I told him, he was an educated guy. Many of my patients were quite educated. I said, the reason is that you accept what there is in the nature. Its vastness, and you accept it. I said, if you think for a moment that in this beach, that cloud shouldn't be there, or that thing should, or that wave shouldn't be there. You accept it as your peace and harmony. So basically, I said,
I'll be right back.
that you, when needles are in, I want you to go to beach. But when you go to beach, accept as it is. Don't try to change anything. Accept it and enjoy it. And it has the same effect. In other words, I'm connecting him with spirituality. What is that vastness? What is that ocean? What is that unlimited entity? That's spirituality. It's unlimited, it's everywhere. And it's always, it's love. Spirituality is love and peace. And this is what you get. This is what he was. And that is spirituality. It means he didn't want to use the word God, but whatever other word is being used, I take it that this is God for him. That's it.
I see. I see. There's a question that has come up. Which one of the body types is more prone towards addiction?
Oh, I think basically, I think it can affect any type. In other words, once a person is addicted, you have to go to sort it out which type it is and try to balance it.
I see.
People sometimes who are anxiety, very much worried, but it can affect all types. You go to sort it out. Yeah.
Okay. The person says here, the Facebook user, they believe that vatas are more
Yeah,
prone to addiction.
anxiety and insecurity. Yeah.
Is that okay? So you find that to be valid?
Pardon?
You agree with that?
Yeah, I think so. Yeah.
Interesting. Interesting. So, that's very interesting. So, people who smoke a bit more and things of that nature tend to be more vata.
Pardon? Those who
Smoke a bit more, have a tend towards addiction, tend to be more vata.
probably, yes, I think more vata, but it can affect any type. Yeah.
Right, it can, but there was the thought that it bends more to that
Yeah.
direction.
Yeah. And in fact, when you treat addiction, one of the things you do is you use anti-vata modalities to calm down vata. Yes, you're right there.
Ah,
Yeah.
very interesting. You calm down vata. What do you do to calm down vata?
Oh, yeah. Same thing. Massage, breathing exercise, pranayama, meditation, yoga. All these, they calm down. In other words, you create more parasympathetic system in the body.
Mm. How do you ramp up vata? How do you ramp up your skinny energy?
Oh, you mean how do you spend energy as a vata?
Yeah, how do you ramp it up? How do you ramp up your skinny energy?
Oh, they don't know what to do. Actually, they are very irregular vata in their habit. They are
Oh, that's pretty
might
good.
run 3 miles one day and not move the other day at all. They can't have it. Usually, they don't have a fixed pattern. They are very poor to stick to their regiments.
Mm.
That's the domain of pitta. But
Ah.
they are very strict in their discipline.
Oh, they're very strict.
Yeah, most dictators are pitta actually. You know.
I won't talk about Putin, but maybe maybe he's a pitta. Is he a pitta? I'm
Yeah,
just curious.
I think he is.
Huh.
Oh,
Putin.
sorry.
Putin.
Putin.
Oh, he's pitta.
Russia.
Bald too. You see, he's angry. He's bald. I think there's no doubt he's pitta. He's impatient. Yeah. And he gets angry. He shows aggression. He's got all the qualities. Yeah.
Okay.
Sorry for us.
Smoke for worry. Vata. Smoke to calm anger or impatient is pitta.
Calm, anger.
Hmm.
Is pitta.
So people who smoke because they're worried are vatas. People who smoke because they need to calm down are pittas.
Yeah.
Well then, Swami, why do kaphas smoke? Because they're bored? Because they've been hanging around pittas and vatas? I'm curious of this answer because I think that I've noticed some of these tendencies, I must say. I think that I have. Um, but you know what would be fun? To go through the world leaders. Um, President Xi, what is it? What is he?
Chi from
Yeah.
Chi
Uh,
Oh, Chin Chinese.
from
yes.
China.
Yeah.
Oh, yeah. I think it's probably combination of
Yeah, I think so.
and some pitta in it, I suppose. Yeah, it's a combination. Swamiji will be able to give us more.
Mm. How about Kim Jong-un? He's kapha.
He's coughing pitta
Probably.
mindset.
I think. Kapha.
Yeah. He's physically kapha, but
Yeah,
mentally
that's right.
pitta.
Pitta.
And pitta is angry, yes?
Angry, yes. Went out of balance.
Ah,
Went out of balance.
You
wow.
see the difference between Putin and Chinese Xi.
Yeah.
What is it? What is it?
Kapha maybe more.
More addicted to foods.
Ah.
Yeah, right.
You know, it would be very good to maybe get our world leaders together and have them practice some Ayurvedic medicine.
I'll give you an example. You see, the very good pitta, where institution I was working, and the government was cutting down on the supply to the institution for hospital and all that. And he gave a big lecture, and he said, "You should write to your representative.
Mm-hmm.
I am angry, aren't you?" And this speaker he was the CEO, bald on his and red skin on his face.
Mm.
And he said, "It makes me angry. Doesn't it make you angry to you?" So I kept quiet. I said, "There's no point telling him why he's angry."
Yeah, let him go.
Oh my goodness. You guys have gotten me quite excited about our Mind, Body, and Soul Summit. I will say that for sure. I'm gonna put you guys backstage. You know what? We've been at this for about an hour and a half. Uh,
Okay.
so I'm going to go ahead and end our session, but obviously we'll be coming back. You know, it's always a good time when I get to hang out with my beautiful Epic Understanding family. I'm so thankful to be able to spend time with you. But I must say,
Thank you so much, Coach. All the best.
yes, thank you. Thank you to my beautiful guests and my beautiful audience who send in questions. Send them in however you like, however you, are comfortable. So I welcome all of your questions. We always have an amazing time together. Thank you very much to our special guest, Dr. Anand. And thank you so much to Dr. Patrick Kute. I
Thank
love it when you come by and hang out with us. Swamiji, you are amazing. You
you.
guys have an amazing night. Don't go from backstage because I want to wrap up with you really quickly here, but I'll simply say bye bye for now. You're winning. You're winning.